Is back pain something that has been plaguing you for a long time?
Or is it something that's just started happening and you don't know why and you don't know where you can get help?
On today's video, you're going to learn the top 3 causes of lower back pain.
And at the end, we're going to discuss what you can do about it.
Hi, I'm Dr. Joshua Nikkanen.
Hi, I'm Dr. Kristina Turkewitsch, and we're chiropractors in Newmarket, Ontario, Canada.
Don't forget to subscribe to our channel, hit the like icon, and the bell notification to be notified every time we upload a new video.
Now let's get into the video.
Now when it comes to back pain, it can be called a whole bunch of different things. We've had patients call it sciatica, they've had a slip disc, even people have said that their hip hurts.
But regardless of where the pain is coming from or what you're feeling, generally or basically, it's all coming from the structures and the spine of the low back.
Now when it comes to back pain and the lower back structures, there's a lot going on in a very, very small area. And it's a very complex area because of the amount of ligaments, tissues, bones, and nerves that are there.
That's it. So this is our structure here, our spiny that we call him. And this is our low back area that we're looking at. This is your lumbar spine. This is your pelvis, which includes your hip bones here, or ilia they're called. And this is your sacrum right here, or your tailbone, which people like to call it. So there's a lot going on, all the nerve roots coming out here, all the joints, all the ligaments that hold everything together, and the muscles that are there as well. That creates that whole structure. So it's actually quite complex. So there's a number of different things that can go on in this area. Okay, so we're going to go into now the top 3 causes for low back pain.
So the first one basically is poor posture or misalignments in the spine. So our spine is actually designed to be straight up and down, and you're supposed to have 3 curves, a curve in the neck, mid back, and the lower spine. So in the lower back, you should have a nice elliptical shape to your spine. So if your spine is not where its optimal position, that can change the stresses that go through the vertebrae and through the bones themselves and actually cause irritation, and that could be one of the causes. So it could be a gross postural change, or you could actually even just have one of the segments just stuck, where it's just not moving. It's just a little bit not of its proper position. It's out of place. And that can cause pressure, and that can cause the back pain. So the first thing that actually causes the back pain, and probably the most common, is poor posture and misalignments.
Yeah. Now, the second cause for low back pain is arthritis. And we've spoken about this one, I think, in multiple videos now. We've gone over it a lot.
Yes, we have.
Arthritis can happen in any joint in the body. And it can happen because of a trauma to that area. So if you've had an injury, maybe a sports impact or some sort of fall or something to your low back area, I mean, you're falling on your bum or whatever, that can create an injury in that area. So then over time, if that's not dealt with properly, you can start getting low-grade arthritis, which, if again not taken care of, will just continue to get worse, right? And progress to get worse. And then you start to have symptoms with that. But it can also happen because of those misalignments that we spoke about. So if you've had misalignments in the spine that are not taken care of properly, they will as well start to develop arthritis over time because, like Dr. Josh mentioned, the stresses going down to through the spine and through the joints isn't proper, right? And so the structures that are misaligned tend to take more strain and stress, and so you can start developing arthritis in those areas as well.
And number 3 really is a combination of things. It's disc bulges, disc herniations, and muscle strain sprains. And so for that, basically, for muscle strain sprains, what we'll talk about that is basically involves the muscles that are attached to the spine itself. So every bony prominence, you have a muscle that's attached to it. So if you've done an excessively long work, like say you were putting down floors at your house and you've had to bend over for long periods of time, you can actually strain and sprain those muscles and ligaments in the spine itself. And that can be one of the causes. It does involve the alignment of the spine and the movement of the spine as well, but it could be a muscle cause. And the last one is the disc bulges, where the disc itself, I like to call it the jelly donut between the vertebrae because it should have a little bit of softness. That one actually can get injured. And that takes a lot of force, or can be over a long period of time. The degenerative process can actually cause it to actually get damaged. Rupture, yeah. So those are 2 other causes. The primary ones most of the time that we see are usually the misalignments poor posture, and the arthritis. Those are probably the most common ones. But we do also acknowledge, and sometimes, you know, the number 3 cause muscle, ligament sprain strains, and the disc. So that can be it as well.
And again, like the disc issues are because of a pre-existing postural or misalignment in the spine.
Absolutely.
So they all really follow one after the other.
And they're very tied in together as well.
Yeah.
So you can have some poor posture that leads to arthritis, that leads to a disc herniation, that leads to muscle spasms and muscle tears.
Yeah.
So they are interconnected, but if we have to break them down, then you get the 3 different segments.
Yeah, then you get the 3 different areas.
Mm-hmm.
So as a bonus, I guess right at the end, we just wanted to quickly go over a few things you can do to help with this, to help with your low back pain.
Yeah. So the first one really, and it probably is kind of simple, is rest. You want to make sure you give your body some time to heal. Yeah. Just as if you had a sprained ankle, you don't want to be walking on that ankle immediately after. You want to give it some rest. So same thing with your lower back. If your lower back's sore, then put yourself in a position that's comfortable. Now, the danger with that is you don't want to stay in a position for a long period of time. So for example, bed rest is probably one of the most common treatments for people for back pain, but research has shown that that's the absolute worst thing that you can actually do. So I always tell our patients, regardless of where they're at, is to keep moving so you can keep the function in your body, because function is life, but you don't want to be in one specific position for a long period of time. So you kind of have to judge basically person to person what you can handle and what makes you feel okay and what doesn't.
I kind of like the rule of 3 as well with that, which is, you know, stand up for a little bit, sit for a little bit, and lay down for a little bit. Yeah. So you're kind of alternating through those 3 things throughout the day. So you're not, like Dr. Josh said, laying down the whole time, because that's really probably, the worst thing you could do. Now, the second thing you could do for yourself at home in this instance is you can apply ice. So actually, let me just backpedal a little bit. So what I like to say is if you're having back pain, I usually recommend that you use ice during the later day and the evening, and you use heat in the mornings to get things moving and to help with blood flow. So you kind of are alternating with these 2 throughout the day, or in the morning and then moving into the afternoon. Because once you're up, you're moving around, inflammation can start to build up more. And so then ice is good later in the day to help reduce that inflammation. And then in the morning, you want some heat just to loosen up the muscles, because they might be tight or they might have spasmed a bit. So the heat will help to loosen those, get some blood flow to the area to promote healing. So that's kind of the routine that I like to use.
Yeah, most patients who have chronic back pain, they'll say they feel great first thing in the morning when they get in a warm shower. It's hard to get out of bed, but once they get in a warm shower, and that's the same thing. So you're heating it up in the morning.
That's it. And I guess, so if it's a chronic thing, kind of alternating heat and ice.
Yeah.
But if it's an acute back pain, you've just fallen and you have, back pain, I would apply ice right away to that.
Sure. Yeah. And that's another rule of thumb. If it's something that's more chronic, heat. If it's short-term duration, like just happened, ice. And the last really treatment for lower back pain probably is the one that we specialize in.
Yes.
As chiropractors, is go see a chiropractor and get adjustments, right?
That's it.
So our focus in chiropractic really is focused on specifically the nervous system, taking care of interference between the brain and the body. But one of the side effects is we do really good with lower back pain.
Yeah, we do.
Right?
We're experts at low back pain.
We are experts at lower back pain. Absolutely.
That's it.
So because when you do get checked for subluxations and you do get corrected, it takes care of the joint issue. That can alleviate the arthritic stuff, and also any of the muscle spasm, muscle injury, and the disc stuff as well. So we basically, with your care at chiropractically, we're taking care of all those 3 causes of back pain.
Yeah, absolutely. And just, it'll promote as well good posture, right? So having good posture, correcting the misalignments, helping with which helps with the muscle spasms and the disc issues. Yeah, so it's all a really awesome package.
Yeah, we take care of it all.
All of it.
So if you have back pain, definitely get checked by a chiropractor. But also you can use those other suggestions that we gave you tonight.
That's it. Because that'll help, at least in the meantime, until you can see a chiropractor.
Absolutely.
Right?
Or between visits.
Or between visits, exactly, for sure. Awesome. Well, thank you so much, everyone. So this was our video on the 3 top causes for low back pain and what you can do about it at home. So it was awesome to have you to the end of the video. Don't forget to subscribe and click that bell icon so you can get our notifications, and like and share this video as well with anybody you feel could benefit. And of course, don't forget to comment and let us know, right? Down below. If you have any more questions, we would love to hear from you. Thanks so much and take care. We'll see you soon.
Bye.
Bye.